Hi everyone, and welcome back to the channel. My name is Gerard, and I've been working in cybersecurity for close to 15 years. Over the years, I've consulted with healthcare organizations on HIPAA compliance as a CISO at Patron Cyber Security. I've also worked at CompTIA as a senior application security engineer, where I help develop security policies and strengthen application security programs. I hold certifications such as the CISM, the CEH Security Plus, and the Advanced Security X, aka CASP Plus. And my team at Patron Cyber Security runs a full CISO program helping healthcare providers stay HIPAA compliant while protecting patient data. Today I want to share the top 5 common HIPAA violations I've seen again and again in my career. Whether you're a doctor, a practice manager, or an IT professional, these are the mistakes you want to avoid at all costs. Number 1, unauthorized access or disclosure. Unauthorized access or disclosure of PHI, or protected health information. So this is when employees peek into patient records they shouldn't. Sometimes it's out of curiosity, like looking up a celebrity or even a friend. And sometimes it's unintentional, like talking about patients in public spaces. So a real-world example would be this. California hospital fired multiple employees after they accessed a famous patient's file. They didn't leak the info, but just opening the file without a legitimate reason was enough for the HIPAA violation. At Patron Cyber, I tell clients access must be restricted to business necessity. Curiosity is not a valid reason. It's a liability. Violation number 2, lost or stolen devices. If a laptop, phone, or a USB drive containing PHI isn't encrypted and it goes missing, it's a disaster waiting to happen. So an example of this would be a Massachusetts medical group paid out $1.7 million in fines after a stolen laptop exposed more than 800,000 patient records. When I was working at CompTIA on application security, one of the biggest lessons we applied was encryption everywhere. Whether it's devices or apps, data must be protected in transit and at rest. Number 3, improper disposal of PHI. This applies to both paper and digital records. I've audited clients where medical charts were tossed in the trash instead of shredded, or old hard drives were donated without being wiped. An example of this would be a national pharmacy chain got investigated after thousands of prescription bottles with patient info ended up in public dumpsters. You need to have a written data disposal policy. Regulators don't just care that you say you dispose properly, they want to see proof of the process. That brings us to violation number 4, lack of administrative safeguards. This isn't a tech issue, it's a management issue. It's failing to train staff, failing to update policies, or letting employees have unnecessary access. At CompTIA, part of my work as a senior application security engineer was writing and enforcing security policies. And in the healthcare world, for example, I've seen organizations fined not because of data breach, but simply because they couldn't prove their employees had completed the HIPAA training. So here's a tip. Log every training session, update your policies annually, and run regular access audits. It shows regulators you're proactive, not negligent. And finally, number 5, failure to secure electronic PHI. This is where cybersecurity and HIPAA fully overlap. You got weak passwords, unencrypted email, outdated firewalls. It's a hacker's dream. Healthcare is not one of the most targeted industries in the world for cyber attacks. For example, a hospital in Florida was fined after hackers breached their systems and investigators discovered they weren't encrypting PHI or enforcing strong password policies. From my experience, whether it was building AppSec programs or running HIPAA compliance projects as a virtual CISO, the message is always the same. If it's electronic, secure it like your reputation depends on it, because it does. So let's recap. Top 5 HIPAA violations. Number 1, unauthorized access or disclosure. Number 2, lost or stolen devices. Number 3, improper disposal of PHI. Number 4, lack of administrative safeguards. Number 5, failure to secure electronic PHI. In my 15 years of cybersecurity experience, I've seen both the risks and solutions within cybersecurity in my career. Most violations come down to carelessness or lack of preparation. And that's something every healthcare practice can fix. If you're in healthcare and want to make sure your practice is secure and compliant, reach out to us. Patron Cyber Security will help you identify risks before the regulators do. Thanks so much for watching, and don't forget to like, subscribe for more cybersecurity insights, and drop a comment below with any HIPAA questions that you'd like me to cover next. Thank you, and have a great one.